My name is Bonnie Stone. I'm a nurse practitioner student at Auburn University. Today I'm going to be performing a full head-to-toe assessment on my patient, Dre. For purpose of this video, he would normally be in a gown, but he's going to be able to stay fully dressed today. And also for purpose of the video, I'll only be doing one side, like one ear and one eye. Right now, I'm going to go ahead and pre-state that I have already washed my hands. I've done his body measurements, got his height and his weight and his vital signs. He's all normal, within normal limits. I'm going to inspect his hair now, his ear, his scalp, his face. I'm checking his hair for distribution and for any type of infestations or lesions. I'm going to palpate his head now for tenderness and for any type of masses. Is it tender at all?
No.
Now I'm going to palpate the temporal mandibular joint, which is right in here. Open your mouth for me. It opens with ease. No crepitus or popping is noted. Now I'm going to check his sinuses, the maxillary area here. Any tenderness?
No.
The frontal for tenderness. Any tenderness? No tenderness. It's normal. Now I'm going to inspect his nose with my pen light. I'm going to inspect the turbinates. For patency, to make sure it's pink, moist, and no drainage, and I don't see anything. The septal is midline. Now I'm going to check patency by letting him just kind of pretend to blow his nose on that side and that side. Both sides are patent. Now I'm going to check his mouth and his lips. They're pink, they're moist, there's no dryness or cracking. Now I'm going to let him open his mouth. The buccal membranes are pink, moist. The tongue is pink and moist. Lift your tongue. It's pink and moist under the tongue. There's no lesions. Say ah. The back of his throat is, close your head up just a little bit. The back of his throat is pink. His uvula is midline. I don't see any hip fillings or cavities. I don't see any abnormalities. The hard palate and the soft palate all look great. At this time, I'm going to move to the eyes. I'm going to inspect his outer eye, his eyebrows, his eyelashes, his eyelids. They all are even. His eyeballs, I'm going to go ahead and check his eyeballs. His eyeballs are round and symmetric. His pupils are 3 millimeters and round. That's normal. I'm going to look at the conjunctiva. It's pink and moist. The sclera is white. There's no redness noted. I can see his iris, his pupils, and his sclera. They're all normal, as well as his lateral duct is patent. I'm going to now perform an ophthalmic exam with my ophthalmoscope. I'm looking at his fundus. I'm looking at the optic disc, as well as the blood vessels, the arteries, and the macula. And I'm also going to be looking for the red reflex. Alright, so look straight ahead. Alright. Alright, everything looks great. Okay. Alright, the red reflex is present. I can see the optic disc and the blood vessels are normal and narrow where they're supposed to be. There's no hemorrhages noted or any other abnormalities. Next, I'm going to be looking at his ear. I'm going to be looking at the outer ear. I'm going to palpate it for any abnormalities and masses. Now I'm going to be looking at the inner ear with my otoscope. I'm going to make sure it's patency here, that he doesn't have a large amount of wax in his ear. I also want to make sure that he doesn't have any objects there that do not belong. So I'm going to pull up. The tympanic membrane looks gray, no bulging. Everything is patent. I do see the cone of light, and I can see part of the malleus bone as well. And these are all normal findings. So now I'm going to use my tuning fork, and I'm going to perform what's called a Weber test. And so I'm checking for lateralization. What I want you to do now is hear, tell me if you can hear this sound. I'm going to put this on the bone here on the back of your ear. Tell me if you hear it.
I hear it.
That's a normal finding. So now I'm going to do the Renee test. I'm going to tap it. Let me know when you stop hearing it. Okay, and then tell me when you stop hearing it here. All right, beautiful. All right, so it is going to be heard longer on air conduction, and that is normal than the bone conduction. So now we're going to check our, start doing our cranial nerves. Cranial nerve 1, I'm going to be doing olfactory, so he's going to close his eyes, and I'm going to ask him what he smells when I put this near his nose.
I smell alcohol.
He smells alcohol, so cranial nerve 1 is intact. Now I'm going to check visual acuity. I have a Snellen chart here on the wall. It's probably about 14 inches away from him. So if you can put your hand over your eye, tell me the lowest letters that you see there on the wall.
P, E, Z, O, L, C, F, T, D.
Okay, and do the other side.
P, E, Z, O, L, C, F, T, D.
Beautiful. And so he has 20/20 vision. He was able to see both. Now I'm going to do his peripheral vision. So now you're going to put your hand over your left eye. I'm going to put my hand on my left eye. And then you tell me when you can see. Okay. All right, that's a normal finding. So now I'm going to check his pupils to make sure that they're equal, round, reactive to light and accommodation. So I want you to just look straight ahead. And I'm just going to see how your pupils react to the pen light coming over. Alright, so I'm going to do the other side. Now I want you to keep looking straight ahead, and I'm just going to come towards you with the light. And so it's normal for his eyes to cross, so that is perfect. For cranial nerves 3, 4, and 6, he's going to follow the pen light with his eye, not moving his head. So his extraocular movements are intact. For cranial nerve 5, I want you to show me your teeth. Beautiful. Your teeth are clenched. Beautiful. Now I'm going to do pain sensation and touch at this time. So close your eyes and tell me if it's sharp or dull. Alright, so what do you feel? Alright, tell me now.
Sharp.
Alright, tell me now. And tell me now.
Sharp.
Alright, now tell me where you feel this at.
Arm.
Okay.
Arm.
Alright, beautiful. So cranial nerve 5 is intact. So now I want you to close your eyes really tight and smile. Okay, now frown for me. And then puff your cheeks. Alright, that's intact for cranial nerve 7. Now for cranial nerve 8, I want to do a whisper test. So I'm going to whisper over here. And then you tell me what I said.
5, 6.
Okay.
7, 8.
Alright. So cranial nerve 9 and 10, I'm going to make sure your uvula is intact. So what we're going to do now is let you stick your tongue out and say ah. Beautiful. So I can see your uvula is midline. And so now I'm going to check cranial nerve 11. Shrug your shoulders. And then what you're going to do is push up against me. Beautiful. And then move your head side to side. Alright, 11 is intact. Cranial nerve 12, I want you to stick your tongue out. And then move it side by side. Alright, it's intact. So I can check cranial nerves 5 and 7 and 10 and 12 by listening to your voice to making sure it's not hoarse. At this time, I'm going to inspect your neck, so I'm going to give you, make sure you don't have any lesions or masses on your skin. And then I'm also going to be palpating the neck, so I'm going to give you a cup of water. Alright, so I'm going to let you hold on to this. And then right now, I'm going to go ahead and palpate your carotid arteries. And then I'm going to take my stethoscope and listen to your carotid artery. It's called a bruit, is what I should hear when I listen. Okay. another 2 plus bilaterally and regular. So now I'm going to do your range of motion. Head down, back, and then go side to side and around and round. Beautiful. So now I'm going to palpate your lymph nodes. Posterior, occipital, the carotid, the tonsillar, the submaxillary, submental, anterior cervical, posterior cervical, and then supraventricular. I don't feel any lymph nodes present at this point. So I'm going to inspect and palpate the trachea now. Alright. And then I'm going to palpate the thyroid. So what you're going to do now is take a little tiny sip of this water, and while you're sipping that water, I'm going to palpate your thyroid. You can go. Alright, so I can actually feel that when you swallow, and I don't feel anything abnormal. So everything is within normal limits. So now I'm going to let you lay down, and I'm going to inspect your jugular vein on the side of your neck. So as you lay back, the internal jugular vein does bulge just a little bit, and that's normal. Alright. Alright, so then we're going to sit you up a little bit. And so now what I'm going to do is have you turn and face the wall, and I'm going to inspect your back. So I'm going to check your back and your skin for respirations, as well as your thorax. And so what we'll do now is I'll have my stethoscope, and I will also palpate, just making sure there's not any masses here or abnormalities. And then tactile firmness, you're going to say the word 99 over and over again. Say it again.
99, 99, 99, 99.
Alright, it's normal and symmetric. Now I want you to take a deep breath in. I'm just checking your ribs. In and out one more time. Beautiful. Your ribs open symmetrically. So now I'm going to percuss. I told you about that earlier. I'm just percussing over your lung fields here. That is normal and it's resonant. Now I'm going to listen for something called excursions. What you're going to do is breathe in and out and hold it. Breathe in and out and hold it. So take a deep breath in one more time. I'm going to do it again. Okay. And then I'm going to get my little measuring tape here. So take a deep breath in and out. Now take a deep breath in and hold it. I'm just going to do a little measurement here. It's about 3.5 centimeters, and that's a normal finding. So now that you're still sitting up here, I'm going to listen to your lungs with my stethoscope. Just take a deep breath in and out. Okay, do it again. 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 Do it again. Last one. Alright, your bilateral breath sounds are all normal. breathing is regular and unlabored. So now I'm going to check for Cva tenderness. So just tell me if this is sore at all.
It's not sore.
Okay, you can just hear me kind of. Is that sore at all?
No.
Alright. So beautiful. So now what you're going to do is turn towards me, and I'm going to inspect your chest. So if you had a gown, I would look at your skin to make sure there wasn't any lesions, any sores, any skin breakdown anywhere. And so I'm going to palpate to make sure I don't feel any abnormalities. Okay, so now I'm going to listen to the bonnet. Okay. Alright, I don't feel any pulsations. At the apical point, there are pulsations here. Okay, so I'm going to do that tactile firmness again, and you're going to say 99 again.
99. 99. 99. 99.
Okay,
99.
that is normal, and I'm going to do the percussion again. And that is normal. The resonance is great. No dullness noted. So now I'm going to listen to the front of your chest with my stethoscope, and you're going to breathe in and out again like you did before. Deep in and out. Again. Okay, so now I'm going to listen to your heart. So I'll just focus at the top of your chest area here. And you can breathe just normally. Harmonic. Herbs point. Tricuspid. And mitral. And I can hear S1 and S2 at each point, and it's regular. And I'm going to hear, listen out for any thrills or bruits. Okay, I don't hear anything. So now I'm going to let you lean back again. Alright, so I'm just going to lay my hand on your chest as you're, and I'm going to listen to the stethoscope again. And just take a deep breath in and out. Okay, those are all normal again. I can hear S1 and S2. I don't hear any signs of a murmur. So now I'm going to check your peripheral pulses. I'm going to check in your wrist, that's your radial. And the bends of your arm, that's your brachial. I've already checked your carotid. They're both 2+. So now, for the purpose of this exam, I'm going to go ahead and assess your stomach. I'm just going to lift your shirt up just a little bit. So I'm looking at the skin, the curvature, the belly button. I'm going to inspect if there's any type of pulsations or peristalsis. I'm going to also now take my stethoscope and auscultate the bowel sounds. And we have to do it in all 4 quadrants. So you're going to feel me move my stethoscope across your abdominal area here. Okay, you have bowel sounds active in all 4 quadrants. I'm going to make sure there's no bruise here. Any problems with the renal area? And then I would listen to the femoral, but for purpose of this video, I will not, because the femoral is in your groin area. But I will go ahead now and palpate your abdominal area. And then I'll do some percussion again. Okay, now percuss the liver. And that sound means I'm over an organ versus not. Alright, so now I'm just going to measure that. Okay, so 7 to 8 inches between the different sounds is normal. Alright, so now I'm going to do a palpation to see if there's any mouses. Lightly. And then I'll do a little bit deeper to see if I feel the liver. Let me know if you feel me touching me. And the spleens up here. Okay. Alright, let's see if I feel the aorta, kidneys. And I cannot feel that, and that is a normal finding. Since I'm finished with the stomach now, I'm going to let you sit back up. I'm going to just look at your arms. So I'm making sure I check the skin again, see your hair distribution on your arms. Make sure there's no lesions. Check the muscle mass. There's no places where he's had any atrophy. I'm going to check the capillary refill. Make sure it's less than 2 seconds. Squeeze my hand. And then squeeze my other hand. Okay, and then I'm going to do your range of motion. Push down against me. Okay. I'm going to palpate the upper jugular nodes. Make sure there's nothing in here. I don't feel anything present here. So now I'm going to inspect and palpate your shoulders. Check out your joint here, and then right in here, sternum, all feels normal. And so I would look at the skin again, and so we'll do a little bit of range of motion. Put your arms up like this, and then go back down, and then cross your arm over one at a time, above your head, and then behind your back, and then we'll do it that side. Alright, your range of motion is intact. So now I'm going to move down the arm to the elbow. And I'm going to inspect and then palpate the elbow. There's no crepitus or cracking in its joint. And I'm going to look at the skin here again. And then we'll do range of motion. And you can do it in both arms. And then flip it over. Beautiful, that is normal. So now I'm going to do the lower arm. Make sure the fingers look great. I don't feel any abnormalities in your fingers. And then you're going to check your range of motion. You go up and down, up and down. Clutch your fist. And then move it all the way around. Okay. And then try to close your hands up on mine. Alright, beautiful. Alright, so you're going to close your eyes, and I'm going to put an object in your hand, and you're going to tell me what it is. Your eyes closed? Alright, tell me what that is.
Paper cup.
Right. So that is beautiful. So now you're going to take your finger and touch your nose and touch my finger. And then do it again. And I'm going to move. Do it again. Beautiful. So now I'm going to inspect your legs, your feet, your hips, and your ankles. So you're going to lay back again. Alright. So now I'm going to inspect all the legs. If I could see underneath his pants, I would be making sure his hair was good and distributed like it's supposed to. There's no lesions. I would go ahead and palpate the hip, making it check for range of motion. So lift this leg all the way up. Beautiful. And then this one. Alright, and then cross this leg over to that one. And then cross this leg over that one. And then move this one out. And then that one out. Alright, so that means that your hip range of motion is intact. So now I'm going to check your knee. Alright, I'm just going to palpate it, make sure it's normal. No crepitus or cracking. So lift your knee up for me. Beautiful. And do the other one. So your range of motion is intact there. So now I'm going to check your ankles. Same thing, palpate the ankles, make sure there's no crepitus or abnormalities in the ankles. So then you're going to pull your foot back up against my hand. Beautiful, beautiful, beautiful. And then you're going to press your feet down like you're going to push on the brake in the car. Beautiful. And then twist them all the way around. Beautiful. So now I'm going to check your pedal pulses. You've got dorsalis pedis on top. Beautiful. And you've got pedis on the side. And then it has your not hat on the pants. I would do the popliteal underneath. Alright, so now I'm going to check your reflexes. I'm going to get my little hammer and your capillary refill. Alright, so close your eyes. Sit up on the side of the, you can actually sit here on the end. So I want you to close your eyes and see if you can tell where I've touched you. Can you feel that?
Uh-huh.
And can you feel right there?
Uh-huh.
Where is that?
On my foot.
Beautiful. Alright, so now we're going to check your reflexes. So I'm going to start here in the bend of your arm. Now I'm going to do your elbow. Okay. And then there's one right here on your hand. It moves, doesn't it? And then you've got one in the back. Okay. Now we'll do the Patellar Reflex. Yay! And then you got one here in the Achilles area. Okay, and then the Babinski reflex is just me doing this. And so it's a normal finding that you did not flare your toes. If you flared your toes, that would not be good. So now you're going to stand up for me. So you're going to turn around, and I'm going to palpate your spine. So what you can do is bend over on the stretcher here, and then I'm just going to palpate your spine. Make sure it's not that it's not mouse-shapen in any form, and it is straight and midline. So now you're going to stand up again, and you're going to lean back, and then you're going to go side to side, and then twist. All right, so your range of motion is intact. So now you're going to stand right here and walk towards the door. Just normal. And then on the way back to the stretcher, you're going to walk on your tippy toes. All right, and then you're going to try and do heel to foot, heel to foot, heel to foot. Beautiful. All right, and then come here. The Romberg test is going to have you close your eyes and put your arms out to the side. All right, beautiful. So now you can have a seat here. Okay, and so now we're gonna do just a couple more things. And so let's see. The very next thing we're gonna do is we're gonna test your reflexes. I didn't do your reflexes, so if you will just lay back down here on the bed, and I'm just gonna check your come back all the way. Alright, so I'm just going to touch your reflexes. Alright, so I'm just going to check you and keep your reflexes. And they're moving when I touch them. So, alright, well that concludes my head-to-toe assessment for my patient Andre today. And I thank you for allowing me to do my assessment on you. And that concludes my video.